The Syrian crisis is the greatest humanitarian tragedy of our time. Since the crisis erupted in 2011, more than 300,000 Syrians have lost their lives. More than 1 million people have been severely injured, and over 12 million displaced. 6.5 million of them internally, and 4.7 million as refugees in surrounding countries in Europe. 12.2 million people are in dire need of assistance inside Syria. Currently, 1 million Syrians, including women and children, live under siege with limited or no access to basic necessities and healthcare. Hospitals, doctors, nurses, and healthcare workers who care for the injured have become targets. The Syrian American Medical Society, SAMS, is a professional, non-political organization that represents thousands of healthcare providers of Syrian descent in the United States. When the conflict began in 2011, SAMS immediately responded to the medical and humanitarian crisis in Syria through its medical relief charity, the SAMS Foundation. SAMS began sending medical supplies and medical missions to Syria to help treat the wounded, then quickly shifted into sponsoring field hospitals, trauma centers, mobile clinics, and underground facilities, as well as providing ambulances and emergency medical training inside Syria. And in response to the tragic displacement of millions of civilians both inside Syria and in neighboring countries, SAMS began to provide free healthcare services in refugee camps in Jordan, Lebanon, and Turkey, as well as psychosocial support for refugee men, women, and children, healing from the trauma of war. Additionally, SAMS launched physical therapy and psychosocial services inside Syria. In 2015, SAMS continued to expand its trauma care facilities and primary healthcare services, treating more than 2.6 million people, double the beneficiaries from the previous year. In 2015, SAMS pioneered an ICU telemedicine program by acquiring high-speed internet for reliable communication with specialists in the United States and expanded the program to cover 10 ICUs, treating over 25,000 patients. Furthermore, a new advanced gastrointestinal endoscopy center was launched to meet medical needs. The suffering of civilians in areas under siege has intensified, and the situation has become extremely dire. SAMS delivered baby formula and nutrients to Medaya and Moadamia to treat severely malnourished patients, many of whom were children.
يا عمو قديش صار لك بالاكل؟
7 أيام.
قول والله العظيم.
والله العظيم.
With the exodus of physicians from Syria, SAMS has supported more than 1,700 healthcare providers inside Syria. Additionally, SAMS has invested in the reconstruction and transfer of 3 large standard facilities to underground secure locations, including one built inside a cave. Dr. Hassan Al-Araj, director of Hama Free Healthcare Directorate and the only cardiologist left in Hama province, was instrumental in building this hospital. Sadly, shortly after its opening, he was killed by a targeted airstrike as he was leaving the hospital. SAM's commitment to supporting Syrian refugees continued to grow in 2015, with supporting one of the busiest clinics in al-Zatari refugee camp in Jordan, in addition to clinics and surgical centers in Lebanon. The medical missions to Jordan and Lebanon continued and provided various services, including cardiac catheterizations, eye surgeries, plastic surgeries, and endoscopic procedures. In 2016, SAM's Global Response was launched, a global relief effort that seeks to provide quality healthcare to refugees and population affected by conflicts. In April 2016, SAM's Global Response organized its first medical mission to Greece. SAMS is regarded as one of the most trusted and active medical relief NGOs on the ground in Syria, with dedicated staff and volunteers working in the US, Syria, Turkey, Jordan, Lebanon, and Greece. As the crisis continues, SAMS will continue to provide diverse healthcare services to all needy Syrians everywhere, and will continue to support the healthcare providers in Syria and advocate for their safety. With no end to the Syrian crisis in sight, the number of wounded and displaced people is increasing by the hour. The need is greater than ever. Today, you can help. You can make a difference. Your support will save lives, alleviate suffering, and bring a smile on a child's face. Join us as we strive to support medical personnel who are saving lives while risking their own. Help us build hope for future generations of Syrians. Donate today. Save lives. Build tomorrow.